Okay, hello everyone. I know some more people will be trickling in, but I think we're going to go ahead and get started. Before we do, I just want to remind everyone to please keep your microphones muted and please keep your cameras off unless you are one of today's featured presenters or you are asking a question during the designated question and answer portions of today's webinar. And now to get things started today, I would like to introduce Lauren Derensberg of HRSA. Oh, Lauren, you're on mute. There we go.
You can always tell when a person is, talking and you can't.
Yeah.
Okay. Thank you, Marley. And good afternoon, everyone. Welcome to the Health Resources and Services Administration's December webinar for the DoNation campaign, Advancing DoNation, Finding Strategic Partners. Today's webinar is going to feature recommendations for recruiting new partners, engaging current partners, and developing additional resources to ensure everyone stays motivated throughout the campaign. You'll also learn ways to help partners in your area earn high levels of recognition in the 2024 campaign. So thank you all for joining us. I am Lauren Derensberg, Acting Branch Chief of the Operations and Donation Education Branch in HRSA's Division of Transplantation. I'm also here with my colleague, Kim Rogers, Health Communications Specialist. We, of course, are also joined by our Arcoya team members, Marley Furman, Project Manager for DoNation, and Bree Hennessy, Communications Consultant. HRSA's Division of Transplantation is our nation's unifying voice for organ, eye, and tissue donation. By creating a larger, more diverse donor pool, we can help more people find matches for life-saving transplants. The DoNation campaign contributes to this goal by cultivating a workplace culture that is supportive of organ, eye, and tissue donation and encourages workplaces in all industries to sign their employees and patrons up as donors. By extending campaign participation to all workplaces and prioritizing donor outreach in underrepresented communities, DoNation underscores HRSA's commitment to inclusivity and diversity. We ask the organ donation professionals here today and other professionals in other industries to help grow DoNation and sign up new organ, eye, and tissue donors by recruiting both hospital and non-hospital workplaces as campaign partners. Thank you all for making time in your busy schedules for today's webinar. We are so grateful for your ongoing support and involvement in DoNation. We're going to begin today's webinar by reviewing DoNation's 2024 Workplace Challenge Guidelines. We've seen a lot of enrollments incoming, so we know that there are some of you out there who are very excited about this challenge, and we were really hoping that is what would happen. So we're excited to keep those enrollments coming on in. We will then spotlight DoNation campaign resources that you can use and share to earn scorecard points that are related to upcoming observances. Next, we are excited to have Steve Miller here to share remarks on behalf of the Association of Organ Procurement Organizations. And then finally, we will hear from Gift of Hope and LifeLink of Puerto Rico about how they are recruiting, managing, and supporting DoNation partners in their service areas. Now I'm going to hand it back over to you, Marley, to talk about the 2024 Workplace Challenge for organ donation professionals.
Thank you so much, Lauren. We are excited to remind everyone about the 2024 Workplace Challenge Guidelines. For those of you who were at our kickoff webinar, you may have heard some of this information, but I would like to review it again. Based on the success of last campaign year's July Workplace Challenge, we have decided to create a year-long initiative to enroll new non-hospital workplace partners in DoNation. To participate, you simply need to recruit and enroll new non-hospital workplaces of any size or industry in the campaign from now until September 30th, 2024. The DoNation campaign will track the new enrollments for you and credit them to the reporting OPO or Donate Life State team If you would like to self-report your new enrollments just to make sure that they're recorded and properly attributed, simply email donation@akoyaonline.com with the name and the organization type of the new partner. At the end of the campaign year, we will celebrate the top 5 organ donation organizations that enrolled the most non-hospital partners by announcing their success through Facebook, webinars, and in a special e-blast. All organ donation professionals are invited to participate in the challenge, and workplaces of all kinds are welcome to become donation partners. We hope you'll take this challenge as an opportunity to bring organ, eye, and tissue donation to all corners of your communities. Now, I will pass the mic to my colleague, Bree, who will be discussing some of the new and upcoming donation resources.
Great, thank you so much, Marley. So we have 3 new donation resources that I'd love to spotlight today. The first is our Season of Giving graphic suite, which is available now in the Outreach Materials Library and also available in the Donation Campaign Facebook group. We've created 3 holiday-themed graphics and 1 animation available in English and in Spanish that can be shared on all social media platforms to earn scorecard points. Don't forget that you earn 5 points per graphic shared per platform. Sharing multiple graphics across multiple platforms increases the number of points that you can earn. The Season of Giving runs through the month of December, so there's still plenty of time to share these graphics and earn some points if you haven't done so already. After the Season of Giving, we gear up for Donor Day, which is celebrated on February 14th. This is a series of Valentine's Day themed graphics, and they will debut in the Facebook group in January, and then in the Outreach Materials Library in February. As a reminder, priority social media graphics are typically shared first in the Donation Campaign Facebook group and via e-blast. On the first day of the month of the observance, all of the graphics will be available in the Outreach Materials Library. We have also been very hard at work developing the next issue of Digging Into Donation, which is our newsletter for organ donation professionals. The next issue will feature tips for goal setting in the new year, impart information about Donate Life America's new self-service custom recognition portal, and feature an interview with Morgan Reed of the National Kidney Foundation, ahead of National Kidney Month in March. Keep your eyes peeled for this issue, which we will be distributing in January. We are always looking for new partners to spotlight and new topics to discuss. So if you have a content request or you would like to be featured in the spring issue, please let us know. All right, I will now pass things back over to Marley to introduce our first guest speaker.
Thank you, Bree. I am very pleased to introduce our first speaker today, Steve Miller, CEO of the Association of Organ Procurement Organizations. Steve, the floor is yours.
Thanks, Marley, and thank you, Lauren, and the folks at HRSA for allowing us to speak today. Just want to give brief comments about why this campaign is important to us and to urge all of our members and all OPOs to participate. Marley, next slide. So briefly, a little bit about AOPO. Our mission is to save and enhance lives through organ, eye, and tissue donation. We're committed to advancing the field of organ procurement by fostering collaboration, promoting best practices, and advocating for policies that facilitate the efficient and ethical donation and transplantation of organs and tissues. By bringing together OPOs from across the United States, we strive to improve the processes involved in organ donation, transplantation, and research, and ultimately ensure that more individuals in need of life-saving transplants receive timely and appropriate care. Our overarching goal is to create a future where every person awaiting a transplant has a chance at a healthier, fuller life made possible through the generous gift of organ donation. Next slide. To further this goal, several years ago, we came together as a community and committed to reach 50,000 annual organ transplants in 2026. This is a bold goal, but we felt that we needed to challenge ourselves in the community to stretch, to save more lives. A series of initiatives were developed to drive the organ donation and transplant community to achieve this goal. And these include expanding collaboration across stakeholders, reducing health inequities to improve accessibility of organ transplants, maximizing organ utilization, and driving innovation to increase donation and transplantation. And as you can see, the top pillar that we talk about is collaboration, and this is why the donation campaign is so important to what we do. Next slide, please. In 2022, the OPO community achieved almost 40,000 annual organ transplants from deceased donors, and we're well on our way to reaching 50,000 organs transplanted over the next few years. We also saw an increase in the number of organ donors by 7.5%, representing nearly 15,000 donors, and the 12th consecutive year of donation increases. However, to get to 50,000 organs transplanted in 2026, more needs to be done. Next slide. And that's where the donation campaign is so important to achieving our goal. Collaborating with national partners that share a united mission is vital to our goal to achieve the 50,000 organs transplanted. As a co-sponsor of HRSA's donation campaign, we're actively promoting organ donation across the U.S. and supporting our member OPOs and echoing the donation campaign's messaging. The donation campaign aligns with our goal, focusing on expanding collaboration and increasing outreach to diverse and underserved communities. Through strategic partnerships like this, AOPO is working to save more lives through increased organ donation and transplantation. We encourage all OPOs to participate in the campaign and seek out new community partnerships to support the mission of organ donation. Next slide. Finally, we have educational infographics available to illustrate how the organ donation and transplantation process works. This series is continually growing and revised on an annual basis with the national data release. If you would like custom branded infographics with your OPO's logo and call to action, please email our systems and social media manager, Sitari Satani Nia, and she will be happy to work with you on those. Next slide. In addition, you can reach out to us and connect with us on all the major social media platforms. We're happy to connect to further this collaboration. And with that, there's our contact information if you need to reach myself, Jenny Daigle, who is our Senior Manager of Communications and Public Affairs, or Sitari. And with that, Marley, I'll turn it back over to you.
Thank you so much for your presentation, Steve. Are there any questions for Steve before we move on to our next presentation about AOPO, anything that he presented on, or collaborating with donation? Okay, feel free to drop any questions in the chat and we'll be happy to address them later in the webinar as well. Up next is our first OPO presentation from Madeline Lardner on behalf of Gift of Hope. Madeline will speak about how Gift of Hope manages donation campaign participation in their service area. Madeline, take it away.
Thank you, Marley. Good afternoon, everybody. Like Marley said, we're going to be going over, how Gift of Hope, how we've utilized the campaign, and also supported it from Gift of Hope, and how we've driven those donor registration numbers pretty much through the roof. And how we've done that as an organization. Next slide, please. So a little bit about Gift of Hope, our mission. Our mission is to save and enhance the lives of as many people as possible through organ and tissue donation. And our vision is that every opportunity for organ and tissue donation is successful. Next slide, please. Where our DSA, our donation service area, the area that we serve Illinois and Northwest Indiana. We have a headquarters in Itasca, Illinois, down in Springfield, and then also a Chicago office as well. And what we've done in 2022, we had 526 organ donors, 1,418 transplanted organs, and 1,869 tissue donors. And we reached a milestone in 2022 with having over 500 organ donors, and are hopefully going to be just as successful this year in 2023. Okay, so getting into, how Gift of Hope, how we kind of manage the donation campaign from an OPO perspective, and what that looks like is we have a committee. So at Gift of Hope, we have our Gift of Hope HRSA donation committee, and it's comprised of a few members, particularly our committee leads, which is myself and Valerie. We are both senior donation coordinators for Gift of Hope. We have our super users, Ruth and Ashley. Ruth is downstate and Ashley is upstate in the Chicagoland area. And then we have our team sponsors that are from our executive leadership team, Ihama and Barb. So we typically, the super users and the committee leads, we meet a few times a month to go over the campaign because each one of us covers a specific territory. I cover my pod in south side of Chicago and Northwest Indiana. Valerie covers her pod, Ashley covers her pod, and Ruth covers downstate. So we all manage these different territories that go along with our teams to cover each of the hospitals that are in that territory. And we meet to talk about, new initiatives and better ways to drive the donor registrations, and basically making sure that all of our teams are on schedule for having a successful donation campaign with their hospitals. Next slide, please. So how our campaigns have grown in the past few years. The first time Gift of Hope, but the first time that we participated in the donation campaign was in 2021 for the 2021-2022 campaign. At that time, we were kind of just trying it out to see if it was, something that was possible for us to take on as an organization and be able to support our hospitals as much as we could. So we had 23 hospitals enrolled. We had 15 of those hospitals that reached a achievement level, so whether bronze, platinum, silver, any one of those, gold. And we had 217 donor registrations. After that campaign, we realized that this is definitely something that's possible for us to be really successful at. And that's when we drove into having that committee and building our super users and building our teams and registration. So for the 2022-2023, just this past campaign that just ended, we had 50 hospitals participating. 41 of them reached a specific achievement level, with the majority of our hospital partners reaching platinum, which was awesome. And we more than doubled our donor registrations. And we actually forgot to submit a scorecard. So we were actually at 498 donor registrations for this past campaign, which was wonderful. And for this current campaign, the 2023 and 2024, we have 97 of our hospital partners enrolled in this campaign. Our goal is to double that 498 donor registrations. We have also made an introduction to our partner relations department to see if they are interested in participating in the campaign to, get the fire department, the police department, funeral homes, any one of those kind of workplaces involved in the campaign. And we are also beginning to utilize our community outreach teams, and specifically for that to serve where our hospitals are at their service area, the communities that they serve, where we would utilize the community outreach team to share their link and get as many donor registrations for the hospital community as possible. Okay, next slide, please. So we made some significant changes, and that is why we have that massive growth and success through this donation campaign. And one of the biggest ones was our campaign guide. We realized in past campaigns, in the past couple campaigns, we did a ton of communication with our teams, but it wasn't as good as it could have been. So we were sending a lot of emails, and each email had a certain step to do. But if somebody missed an email, then they were pushed back, or they were off schedule. So we created a campaign guide. Our super user, our committee team created this guide. And it's basically a one-stop shop for participating in the HRSA donation campaign with our hospital partners. And this is kind of what the first page of the slide looks like, but it's a resource guide. It has details, it has ideas, and it has the timeline. And we're going to go over in the next slide exactly what this guide compiled of, that has really made our campaigns very successful and has helped our team members be more organized in the donation campaign to support their hospital partners. So the campaign guide contents. This is the table that is on the guide, starting with what is HRSA. We have a lot of new staff or people who are not aware of who HRSA is, what it stands for, what they do. So the first page of the slide really goes over what HRSA is so they can get a background, and it goes over what the campaign is for and how the campaign drives donor registrations and why we are involved in this campaign, right? So we begin to talk about what our role is. So if you're reading this from a donation coordinator or any OPO staff, if you're reading it from their perspective, you want to know what your role is. So we have a really distinguished bullet points of what each staff member's role is in this campaign. And the biggest one being that we are the hospital's main resource for this campaign. We encourage the hospital to participate in the campaign to promote a positive donation culture in the hospital and also, bring up those donor registrations. And then we help them throughout the campaign with filling out the scorecard, scheduling activities or social media outreach posts, anything like that. And ultimately, we manage the scorecard and we submit it for them as well. So that is kind of how we go over with the role. And then we go over how the campaign benefits donation, right? And that's kind of the no-brainer. When you raise donor registration rates in our hospitals, then there's more opportunity for organ donation. So we kind of explain why the campaign benefits donation and why the campaign also benefits the hospital and our role in hospital development as well, to make those contacts, creating more opportunities for continued learning on our hospital units, and then ultimately increasing donor registrations. Then we go over, of course, the campaign timeline. You have to have those basics in there. So the campaign timeline, due dates, everything like that. One of the really important parts about this is how do you get your hospitals to participate, right? So we have this whole section of the guide that talks about what do you need to do to initiate this process with your hospital, and how do you basically sell it to them that this would be really great for them to participate in. So we have a whole section of the guide that basically has, when you get scheduled with your hospital, whether it's a donation champion at the hospital or it is a key hospital contact, anybody that you come in contact with the hospital can really get you moving for this campaign. So we talk about what needs to be covered in that initial planning meeting, including an overview of the campaign, what your role is in the campaign to support your hospital. You'll go over the scorecard, the outreach materials library that was provided by HRSA, which is fantastic. We talk about utilizing the hospital's logo because we need approval for that. You decide on a donor registration goal, and then, of course, you come up with a wish list. You create this wish list of what do you want this campaign to do? So what events are plausible for the hospital to be able to throw, and how can Gift of Hope support those events or help run them, really? So we talk about kind of the initial planning meeting and how to get the ball rolling with these campaigns. Next, we talk about hospital enrollment. So basically how to enroll when you're submitting your enrollment and registering your hospital for the new campaign. The hospital donor registration link, which is vital to the campaign, of course. So how you submit to get a link, why is the link important, registering for a link, and then we have steps for how to generate a QR code, because as you know, in this day and age, QR codes are the easiest way to get onto that link and sign up to be a registered donor. So we go over very basic information like that. Then we go over the hospital scorecard, filling out your hospital scorecard, exactly how you do that. And then scorecard submission, and who's responsible for scorecard submission, which is we have it where Gift of Hope, our team members are the ones who submit the scorecards, but with collaboration from the hospital is who fills it out, right? And the last, but most certainly not least, is something that our committee has created for our teams called our Materials and Ideas Library. And Marley, if you wouldn't mind, please going to the next slide, we'll get a little bit more into what that includes. So we have an ideas library. We got some feedback from our Gift of Hope team members and basically said, we're looking at the scorecard, we see all these really fantastic things, but we want some more. We want some more ideas of what we can do, because there's that section right on the scorecard that's for unique ideas. And so we created this ideas library. And the first thing it covers is the national observances and celebrations, because it's always a good idea to know when those dates are and when you can help your hospital celebrate those dates, which is awesome. And then the next is about a little bit more specific details about activities on the scorecard. So we go into a bit more detail about honor walks, and about having a donor memorial ceremony, things that people, they read them and they're like, oh, that would be nice to do, but how do I do that? So we go into a bit more specifics about that. And the last thing that is in this ideas library, which is fantastic, it's a unique ideas for past campaigns with pictures. So we created this section where we've had people in past campaigns do these really unique activities with the hospital that could drive other people to do either those same activities or spark an idea for a new one. So some examples of that is at the University of Chicago Medicine, I had the QR codes printed on stickers, and those stickers were put on the lids of all the coffee cups for the month of April, National Donate Life Month. That really drove a lot of donor registrations. And that was fantastic. Another one is Chalk the Walk, where hospital staff or whoever go outside and they chalk their walkways with National Donate Life Month stuff, or sign up to be a registered organ donor, anything like that. Or a poster contest we've had before, where the winner of whatever unit makes the best, poster that supports organ donation, they receive a free pizza party, stuff like that. So just really fun, unique ideas to help, get those points on the scorecard and help raise donor registrations, and just really create this positive donation atmosphere at the hospital for people to have fun, but also realize that, organ donation, tissue donation is very important and very life-saving. And this is a way that they can make a difference. Okay, next slide. So we also have a social media resource guide. So you heard me say, we have on there the wish list you can make for, and one of the things that we, typically find kind of one of the easiest ways to get hospitals involved is if they post their campaign on their social media. So Gift of Hope, we have a approved online registration drive social media post for our partners to use, where it includes specific links, or I'm sorry, not links, but specific like hashtags or who you tag for what social media. So Facebook, Twitter, which is now called X, Instagram, LinkedIn, any one of those. And we have examples of posts that can be shared. And obviously we tailor them to the hospital, but it's just a nice way to provide that to the hospital so that their marketing team isn't like, oh shoot, we got to create all these new materials for the campaign. No, they do not. We've already created them for you. Let's just collaborate to make them more geared towards that hospital, towards that community that they serve, right? Okay, next slide, please. And that is all that I have from A Gift of Hope. That's what we are doing to, promote this campaign. We've had a lot of fun doing it. We've made a lot of connections through our hospitals. It's been very successful. We hope to continue to be successful, continue to participate and support this campaign as much as we can. Other than that, I will open up to the floor to some questions. No questions? Okay, I think there might be one more slide, Marley. I think my contact information might be on there. Oh, no, there's not, just my name. Thank you all. I wish you all, if you are participating in the campaign, I wish you all the best of luck. You can easily reach out to me. Just reach out to Marley for my contact information. If you have any questions or need any suggestions, I'd be more than happy to work with other OPOs to kind of guide and help make their campaigns as successful as possible. Thank you.
Wow, thank you so much, Madeline. That was such a comprehensive, thorough, and incredibly useful overview of how Gift of Hope manages the campaign. Thank you so much for that. Up next, our second OPO presentation today is from Marisa Boneta on behalf of LifeLink of Puerto Rico. LifeLink of Puerto Rico had outstanding participation from both hospital and non-hospital partners, and Marisa is here to share their secrets. Marisa, take it away.
Thank you very much. Good afternoon to everyone. My name is Marisa Boneta Dueño, and I'm the Public Affairs Director for LifeLink of Puerto Rico. I've been with the LifeLink family for the past 19 and a half years. And we've seen a great impact on these campaigns and the impact that it has brought to our communities. First slide, please. LifeLink of Puerto Rico was founded in 1994 and is part of one of 5 divisions of LifeLink Foundation. We cover the service area that includes Puerto Rico and the U.S. Virgin Islands. Puerto Rico has a population of around 3.0 million people, and the U.S. Virgin Islands near 98,000. I'm sorry. We serve both Puerto Rico and the USVI, and we've always developed and engaged in the opportunity of addressing more workplace partnerships for our efforts. We recognize and we understand the importance of workplace partners for our day-to-day mission. So we have encouraged adding new ones every year. Next slide, please. As you all know, back in 2003, these efforts began with the HRSA Collaborative, in which we participated. Afterwards, they began having recognitions for hospitals that were participating in those collaboratives and that have demonstrated great impact in the community. And for the first time in 2016, we participated in the first hospitals campaign. At that point, we had 56 hospitals participating from a total of 62 hospitals in our service area. So for the first time, participating was awesome for us. The compromise and the efforts that hospitals put up into in collaboration with our organization. And then we continue to participate through the years, and that included also the donation campaign. That has also been incredible to our community partners. Next, please. As you know, the Breakthrough Collaborative was began in 2003 at the request of the Secretary of the U.S. Department of Health and Human Services, concerted effort of the Donation and Transplantation Committee to bring about a major change to improve the organ processes throughout the United States. And it was very important, the beginning of these efforts, because it has brought a lot of more attention into the importance of working in collaboration, not only with the community and educating the community, but also bringing hospitals to be part of that efforts. Next, please. Our first recognitions came through hospitals. They were our first workplace partners that were included in this movement. As I mentioned, our service area comprehends Puerto Rico and the U.S. Virgin Islands, and we were able to have in those first recognitions and campaigns, 56 hospitals participated that received medals and recognitions. The first 56 hospitals, received bronze, silver, gold, and platinum medals as recognitions for their efforts on the activities that they were taking and driving on. So for us was a great beginning for these campaigns, and was a solid beginning for these efforts that have driven and brought us very satisfactions through the years, because each year our relation with hospitals and community partners gets much and much better. Next, please. What we did with hospitals that we also replicated later on the donation campaign. We considered them and received them as workplace partners, and we began taking to hospitals our institutional campaigns. Every message, every campaign that LifeLink of Puerto Rico was taken to the community was taken to hospitals on the hospital side, so that the message that we were taking to the community would be the same that hospitals were receiving. We wanted to have a cohesive message throughout the entire our entire service area. So our institutional campaigns were always driven and taken to the hospitals so they could know and understand our mission, our vision, our values. We also work on special campaigns. And for example, for several years, 8 years, we celebrated what we called our Díselo a tu Familia, which was our Tell Your Family campaign. This was a huge campaign that was driven out through hospitals exceptionally. I could say that it was more exceptional on the hospitals than on the community, because the support that hospitals gave us moving through this campaign was incredible. And we could see that through the huge amount of registrations that through the years we were able to secure, thanks to the Tell Your Family campaign taken to hospitals. Besides the Tell Your Family campaign, we were also able to last year, for example, we celebrated Be the Gift campaign. That is a campaign that some OPOs have received and have decided to jump in, that was created by Tennessee. And we also took Be the Gift campaign to hospitals. We also celebrated Donor Day, February 14th. Instead of just thinking about Valentine's, we also dedicated that day to donors. And we, for example, created special activities, and we delivered to hospitals that have had donors during that year, special arrangements full of balloons with the amount, representing the amount of donors each hospital had, were able to conceive and to take to a final result. So besides that, we also celebrated National Donate Life Month. They love that National Donate Life Month and celebrated with us every year. And to those efforts, we included Hospitals Weeks, we included Nurses Week, we included Christmas. So during the entire year, we were taking what we were doing on the community to hospitals and engage them also in our campaigns. Also, next, please. Later on, we began working on the Do Nation campaign. And this campaign was really well received also in the community. So we began working on other efforts that to secure the participation of some of our partners in the community, such as the Puerto Rico Kidney Foundation, media radio stations, media TV stations. We also had other organizations that joined us on this effort with the donation campaign. Over 5,000 registrations were secured through the donation campaign this year. And this included diverse events that could be mentioned, such as 5Ks, such as registration drives, and other special campaigns and events that we have taken to hospitals. And they have worked very nicely, and they were well received from our partners in hospitals. Next, please. As a result of this donation campaign, 820 media registrations came out from media partners. Over 1,000 came from events coordinated by DMVs, and over 600 and something for DMV offices, who also partner with us in these efforts for donation campaign. So we've been just taking this campaign to all our partners and invite them to join us. We also share on our social media events, activities, photographs of their efforts. They love to see themselves in those photographs, and they enjoy being part of those campaigns. This has helped us spread through social media our efforts, because they keep sharing what we post on our pages on their own pages, and that has also brought a lot of movement in our social media pages. Next, please. And the best takeaways from this, we keep reminding our partners, our workplace partners, on the importance of participating in these events, because at the end they will be rewarded and recognized by their efforts. We document every event that we celebrate with them, not only with donor registrations, but also with photographs and scorecards. We do promotion, a lot of promotion on social media, and on all of our social media channels, Facebook, Instagram, and also X. And we celebrate champions. You know, we recognize those specific people that have worked hard in these campaigns, and we recognize them. We celebrate we institutionalized last year a new award event in which we recognize the efforts of these individuals that have taken donation a step forward and have make donation processes a part of their own mission. So that has also been very helpful in terms of our recognition and all the rewards that we've received from these campaigns. And that's why we invite others to join it and to be part of it, because at the end, it is an extra help to continue to spread the message of the importance of organ donation, and it motivates other partners to live the mission as we do it. And I think that's my last slide. Thank you. If you have any questions, I'd be more than happy to answer them.
Thank you so much, Marisa. I see a question in the chat here from Annie Fur. It says, as far as event documentation goes, can you discuss some of your methods specifically? How are you keeping track of registrations in real time at community events?
And okay, in Puerto Rico, there's a phenomenon, if we could call it like that. There are lots of people that love to register on paper forms. So we keep track of those paper forms, and we also create on our registry, we create an extra where do you hear about us, and we add there the events that we create for communities, and that allows us to track what specifically or how many specific registrations we could attribute to specific events. So that's very helpful for us. Also, hospital development is great on following up with scorecards and registering those events in their documents, so that we keep track of the amount of registrations per hospital, the amount of registrations per community partner, because at the end, this is what let us know how effective we've been with our campaign, and if the community is engaged. So keeping track of registrations for us is very, very important. I hope this answers your questions.
Annie first says thank you with 2 exclamation points. So I think you did. Are there any additional questions from Marisa or for any of our other presenters today?
I would like to add that in terms of TV and radio stations that have partnered with us, it is something that has come along through the years. We've developed a really, really good relationship with media, our media partners, that has not only allowed us to receive non-paid advertising, non-paid media opportunities, and media interactions. And they have also learned to respect and understand our processes, and have become also special helpers in promoting organ donation. So bringing them into the conversation and letting them know that they could be part of this, giving them recognition for even those small efforts that they could do, or they might think are small efforts that for us are really huge. it is important, and that will allow you to count them as partners too.
Thank you, Marisa. Okay, I think that concludes our presentations. I just wanted to thank everyone again. This has been such a wonderful webinar as far as the just useful information, like actionable strategies that I'm hoping that attendees today can take back and start implementing. Seems like the through threads of these presentations are the importance of collaboration and of recognizing the partners in your area so that they maintain that motivation. It's fun to see that echoed throughout as just a clear indicator of what helps these campaigns succeed. If there are any other questions that come to mind following today's webinar, general questions about HRSA can be directed to donation@hrsa.gov. That's HRSA.gov. Any questions about the donation campaign, the 2024 Workplace Challenge, or anything else donation can be sent to donation@akoyaonline.com, and OPOs are always welcome to email their donation liaison directly. We welcome coaching calls. We've been having a lot of them, and we're happy to have more of them. They can be as fast as 5 minutes or as long as a half an hour or more, however much you need to strategize and whatever questions you have, we're happy to answer. And with that, I would like to kick things back over to Lauren Derensberg to close out today's webinar.
Thank you very much, Marley. And thank you to each of our speakers today for sharing your experiences and expertise with us. This has really been a great webinar. Thank you also, everyone, for joining us today, making time to join us, but also to advance the Do Nation campaign. Your involvement is really what makes Do Nation work, and we're so grateful for your support and commitment. As a reminder, Do Nation's celebratory 2023 campaign recognition video is coming soon on HRSATube, so be on the lookout for an e-blast with the link to view that, and be sure to share it widely so everyone knows how you performed in the 2023 campaign. Marley already mentioned where to reach out to us for any questions, so please don't hesitate to do so. And if you haven't already, please encourage your OPO to join the Do Nation campaign Facebook group to make sure the social media manager can view and access Do Nation campaign graphics, materials, and messaging. And with that, we encourage you to follow along with HRSA. Those of you who have been tracking on the Organ Procurement Transplantation Network know that we're working to modernize the OPTN, so you can catch all of those updates on our HRSA web pages. And we encourage you to also sign up for HRSA's e-news. And with that, on behalf of Kim and myself at HRSA, thank you for taking the time to join us today and for your work as Do Nation partners. We wish you success in the campaign and a happy holiday.
Thank you all. Thank you, Lauren, and everyone have a great day.
Thank you.